to the mayor.
Good evening, everyone. And I'm Gary Christenson, Mayor of Malden, and we're back with another update regarding COVID-19. I want to thank our guests here this evening. We have Chris Webb, our Health Director. We also have Kourtney Nickerson, Chairperson of the Board of Health. And finally, we have Paul Hammersley, our Addiction Recovery Resource Specialist. And we also want to just take a moment to say thank you to Ron Cochran, who is helping us organize tonight's show, as well as the one and only Malden Access Television. So what I thought we'd do is go around first to give the panelists a moment to introduce themselves to you. And then, of course, the most important thing, we want to talk about what's on your mind, especially when it comes to the vaccine. And then we're going to open it up to questions. If you want to call in this evening, the phone number is 781-388-9394. In talking with the panelists just before we began tonight, the best way to describe where we are is there is light at the end of the tunnel. So after, I think this might be our 15th or 20th show, we finally think we may be getting to where we all want to be. So without further ado, let's meet our panelists, who I think you know already, but if not, let's have them introduce themselves. They're also going to provide you with their contact information, just in case there was a question not answered this evening or something came up that you thought of after the show has ended. So let's go to Mr. Webb first.
Hello, everyone. Great to be back. It's always good to do these shows. We enjoy sharing the information that we have. If you want to reach me, I can be emailed at cwebb, W-E-B-B, at cityofmalden.org, or you can call me at 781-397-7049.
Okay, and Kourtney?
Sorry, I had myself muted. Hi, everybody. Thanks for having me again tonight. I am a research scientist that serves on the Board of Health with a background in infectious disease. So I'll do my best to sort of help you guys understand some of the information out there, as well as give you my perspective as a mom and a member of the community. And you can reach me through Chris is probably the best way. So shoot him an email, please, if you have any questions, and he's happy to forward that information along to me. Thank you.
Thank you, Doctor. And then finally, Mr. Paul Hammersley.
Hey everyone, I'm Paul Hammersley. I am the Addiction Recovery Resource Specialist out of the City of Malden's Health Department. And first off, I want to say thank you very much to the mayor for inviting me on tonight. And I can answer any questions regarding addiction or recovery services. I can be reached at 781-838-2203. And my email is phammersley, HAMMERSLEY, at cityofmalden.org. Thank you.
All right, thank you. Now, let's begin as we have in the past. So let me ask you each one question, and then we'll go to our audience to see what's on their mind. Let me start with Mr. Webb. Obviously, the question I believe that everybody's talking about is around the vaccine. When will it be here? How will it be distributed? So do your best to let people know what the latest is regarding the vaccine.
All right. The latest and greatest is that the City of Malden, in our infinite wisdom, decided to go with a regional approach for at least the public safety clinic. We haven't really been tasked yet with any other clinics. So what we're hoping to do is a region. There's 6 cities and towns involved: Medford, Malden, Melrose, Wakefield, Winchester, and Stoneham. Next week, starting on the 14th, yes, the 14th, we're going to start vaccinating in Medford. The next day we'll be in Malden. The next day we'll be in Melrose. Those public safety people will be able to register and schedule their appointment in a module called PrepMod, which we will use further down the road when we do mass vaccinations as well. Everybody will be given a link. They'll be able to go on, register, go through the screening questions, and it will speed up the process. When you get to the clinic, we hope to hand you a shot record card. You'll proceed then to the nurse, get your shot. You'll be seated for about 15 minutes to make sure you have no ill effect, and then you'll be on your way. The public safety ones will be a little different, but only marginally so.
All right. So, Chris, next week, police, fire, EMS only.
Yes.
If you had to guess, when do you think the community at large might see a vaccine?
From what I'm hearing on vaccine distribution so far, I would say probably mid-February. I got a lot of questions today from different groups of people who are seeing the state website that says February to March is the general population. It's not February 1st, I can assure you of that. So that's why I'm saying mid-February is more realistic.
Okay, very good. So let me jump to Dr. Nickerson. So one thing that people have asked us now that the vaccine is imminent, when can they stop wearing masks?
So we're probably going to want to keep wearing our masks for quite some time. And that's because it's going to take time to get everybody vaccinated. It's going to take time for the vaccine to be effective. And even though people are going to get vaccinated, there's going to be a population that can't get vaccinated or might be unwilling. So we're going to see the virus in circulation for quite a while. So I would get comfortable wearing your mask and continue to do so for the foreseeable future.
Okay, thank you. And then finally, Mr. Hammersley, you have told us that based on what's been happening over the past several months, you have seen an uptick in overdoses, and you wanted to alert the community to watch out for that and to also be a resource for them, as you always do. So why don't you talk about what you're seeing as a result of what's going on?
Yeah, real quick, we have seen an uptick, and I believe everything is due to COVID-19. Everyone is isolating. There are no in-house recovery services meetings for people, and people in recovery generally, they need to be one-on-one. It's FaceTime. They like to talk to each other in person. The Zoom thing really isn't working for folks in recovery, and isolation is no good for people in recovery. So the numbers are up. I don't want to alarm anybody, but we do have some numbers in the past month or so. We've had quite a few fatalities. We've had 7 since October. We had 5 the week of Christmas, and we've had quite a few overdoses, and we're looking into reaching out to all the problem areas. I've been out there the past couple of days giving my resources. Just today, I was down with the fire chief, and all our resources are on the apparatuses. They're going to be passing out at any scene that may come across someone that may need services. The same with the police. And again, we have seen an uptick. I'm here to take questions just to let people know what to look out for. We have Narcan available with training. If folks are looking for Narcan training, we could teach people how to do that.
All right, and Paul, just before we leave you to take some questions, why don't you tell folks some of the good news, which really blew me away on the number of people that you have been able to help in the past year.
Yeah, so we have in the past year there's an organization called Malden Overcoming Addiction that works very closely with the city of Malden, and through both organizations there are scholarship programs, and a scholarship program is where we can offer someone, Malden residents only, that may be in need of assistance. We can pay for the first 4 weeks into a sober living facility, and that gets them back on their feet. And then in week 5, it's up to them to pay their rent. We've got some grant money, and we've put 18 people through that program, and we are currently recovery coaching over 30 Malden residents. And we're at about a 28 to 30% of folks that are staying in and hanging in recovery. So there is a really, really good, we have some great numbers there. And we also just ran a recovery coach academy where we trained 15 more coaches. During COVID, we did it virtual, and 15 residents and 3 other officials were on that list who did graduate the 30-hour academy to become recovery coaches to help in the issue.
Excellent, good work. All right, Mr. Cochran, so what do we have in the queue?
I think what we should do first is I'm going to share an image here. Mr. Webb made reference to it, and that is the state's infographic based on the vaccine rollout. So I think you can all see that shared on your screen right now, and it lays out phase 1, phase 2, and phase 3. This links to a website on mass.gov, which gets into greater detail about these bullet items and the details about who belongs in which phase. And so we shared that a couple of days ago, and it definitely stoked a lot of interest from our residents, and some great questions came of that. So I'd like to start by diving into that Facebook thread just to ask a few questions right out of that. So the first one that we'll talk about here is identification of which phase that you're in. And I'm going to couple this with another question, which was, there was some concern over, okay, so you know, it was straightforward in the category 5, but obviously there's always this gray area about whether or not you are in or out of a phase. Who's the determination on who's in what phase, and what sort of validation methods is the state planning to use to be, hey, yeah, you really do belong in that phase and you're not just here jumping the line?
All right, Mr. Webb.
Well, luckily the state has contracted with a company to provide us with software that manages all of that. It's called a prep mod. Everybody that in the state that gets vaccinated will have to have registered in prep mod. We will have a call-in center set up when phase 2 starts for people who aren't computer literate or are having a difficult time with it. It's a very, very easy site to work in. Let me just say that. You're going to open it up and you're going to fill out a form. That's really it. Hit submit and you're going to be done. And it will tell you, you're going to be able to choose the date and time that you want to be vaccinated. So you may have a choice from mid-February to the end of April. Pick what date and time. We're going to try and, based on manpower, have as many stand-up clinics as we can, various times of the evening and the day, so that we can get everybody through. We'd like to have a drive-through clinic. We're still waiting for approval from the state on that. I think it's going to come. I don't see how else we can do it. We're going to have to do about 130,000 vaccinations, give or take 10,000. So we've got to come up with some unique ways, but we have the initial plan would be use the Salem Woods School Field House. There's plenty of room. It really is cut out for what we want to do. And then we'll be focusing, we have those plans in place. We'll be focusing in the short term on homebound people, handicapped folks that just can't manage or don't want to. We want to make sure that they get treated at home. And seniors who can't get out. So we'll hopefully have a senior plan for the buildings. We have a lot of conditions placed on us based on the vaccine. Keep in mind that once it's defrosted, we have a 30-day window. But the minute you put a hole in the top of the vial, you have 6 hours to use those 10 doses or it goes bad. So we've got to figure out what we can physically do in a 6-hour period for our seniors in those buildings and keep the vaccine effective. I don't think it's going to be that big a challenge. But the last point I want to make is phase 2 has not been announced, and no one in the state knows right now who's vaccinating who in phase 2. Just know that your identity will be verified through the registration process.
All right, and Chris, can you also make it known that we are tending to forget that this is one of 2. So if this happens mid-February, when would people then get the second dose?
Let's say we do it on Valentine's Day. We'll do it 28 days from Valentine's Day, which would be March 15 or 14, 13. So we'll have a clinic. As soon as we set a clinic for tomorrow, we set the next clinic up for 28 days later. That will inform the state the vaccine we will need in that time frame. So they'll be stockpiling that based on our input through our current clinics and future planning.
Okay, and Dr. Nickerson, some people have stated, well, I may only do the first shot and not the second. Can you talk about why someone wouldn't want to do that?
Well, we haven't tested what happens if you only get one shot. So there's just not a lot of information known about how well that will protect you long term. So right now, I know they're interested in doing those studies to get that information to find out how well people are protected, but we just don't have that information yet. What we do have to go on is where they've given multiple doses and those vaccines that have been given emergency approval. So we want to trust in the processes that they used to test those vaccines and make sure that it's being distributed effectively so that the population is protected.
Okay, very good. All right, Ron, what do you have next?
Okay, the next question is from Stacy on that same Facebook thread. And she's saying that I'm seeing in other states like Florida that some people in their phase 1 category, i.e. medical workers, are getting their vaccine through local county-based health departments, not through their employer. And our first question under that is, will that be the case in Massachusetts? If a Malden resident falls into phase 1, is their employer handling the vaccination?
Okay, Chris?
The phase 1 is all public safety. In the state of Massachusetts, it's different from the state of Florida. State of Florida has a much broader category in phase 1. They're a giant state, and what they've done is taken the vaccine and sent it to high risk counties first. We don't have county government in Massachusetts, and that's why the local health departments will be vaccinating first responders only in phase 1.
Chris, but Ron brings up a good point. You and I talked about this at our meeting this morning. We still don't know for the community at large as to whether or not we're going to be doing it or their primary care will be doing it, right? That hasn't been decided yet.
That's true. We don't know who's going to be mobilized. I think that pending the new administration at the federal level, I think we're going to see a lot of guidance that we've been working with change. That is my hope. I'm hopeful that the federal government will motivate and activate some of the federal resources that haven't been. I can tell you that what I know of the federal plan for a pandemic the book hasn't even been opened yet. So I'm confident that if you go with the pandemic plans that they had in the past, the states will have a much better experience taking care of their citizens.
Okay, over to Paul. Paul, in your dealings with people in recovery, is there an eagerness to get vaccinated? And are they concerned about when they'll get the shot?
Everybody's asking the same question: when? It's across the board. Everyone is looking to get back to some type of normalcy, and that is in recovery as well. I haven't met one person that doesn't want to get vaccinated.
Okay.
In my field, no one has told me that they're not getting the shot, but yeah, everybody's looking forward to it.
Yeah, and I know you work with a lot of different organizations. So one of them is MORE, and are they trying to get into one of these phases, meaning sooner rather than later?
Everybody is, yeah. I mean, of course they are. They're at the state house. They're at the state level. They're talking with all their reps. Yes, they are trying to speed up the process. But again, as Chris can say, there's just one speed right now.
Okay.
Yeah. So, yes.
All right. What do you have next, Ron?
Okay, so we're going to keep along this track. We've certainly had a little bit of a small percentage of people, but still doubting or still at least maybe cautious about the vaccine itself and what effects that it may have on their body. So I saw everything from I'll never do that, I'll never get that vaccine, to I kind of want to see where this goes before I get a vaccine. I guess what would you say to those people that are sort of like sitting on the sidelines waiting to see if there are any harmful side effects?
Dr. Nickerson?
I would say, I'm glad you're asking questions. You've got time, a little bit of time. We're waiting, when it is appropriate for us each to get the vaccine based on where we fit in the queue. So that's good, because it means that there are people that are on the front lines that need that protection immediately that are going to get it, and then they can report back. We've already started to hear very favorable things. We know that there were early reports of allergies and allergic responses, and you saw how quickly that those concerns were addressed in terms of people having a waiting period after they received the vaccine to make sure there are no adverse reactions. And that's just an immediate reaction to what observations that were being made. So I think as of right now, the response to the vaccine has been very favorable. That's why we do clinical trials. And even though they didn't have the extensive long-term monitoring that we normally have when we're testing new vaccines, the short-term risks of getting COVID are much worse than anything we saw with the vaccine trials. So I appreciate people's cautiousness. I think if you have questions, reach out, ask us, ask your physician. Ask pharmacists. They're also wealths of information. And check your sources. If you do research on the internet, make sure you're looking at reputable sources. The CDC, World Health Organization, all great places to look. And reach out to us too. We'll help you navigate some of that information. But it's good to be cautious and it's good to stay informed. And I would encourage everybody, when you're eligible, go get that vaccine if you're comfortable with it.
Okay, Mr. Webb, you want to add anything?
I think it's well covered. It really speaks to the point. It's important to have that, to ask that question. A lot of people may have pre-existing conditions, and when you register, those pre-existing conditions will be asked. So you don't have to worry about is this or that. It will be listed. If you have one of those, it doesn't mean you won't get vaccinated. It just means that the vaccinator knows to have another conversation with you and then monitor you for an allergic reaction for 15 minutes. So
Okay.
we will be watching out for you.
Chris, so some people have asked which vaccine. What is the state going with? Which company?
We are going with Moderna, which is.
And you said you were pleased about that.
I
Why?
am. It's a much easier vaccine to deal with. It doesn't have the temperature fluctuation that we, super cold to defrost and then vaccinate. It's a very time sensitive thing. Moderna is different in that it comes frozen, but it defrosts much quicker. And then once it's defrosted, it can be left alone in its bottles for 30 days. It's a shelf life of 30 days, which is really quite remarkable. And then, like I said before, the vial, once punctured, only has a 6-hour lifespan.
Okay. All right, very good. Back to you, Ron.
Sure. So our next question is whether or not folks who do not have access to the internet will be able to register. How will they be able to register for the vaccine?
Chris?
We're going to set up a phone bank. I spoke with Anthony Rodriguez in IT yesterday. He said that wouldn't be much of a problem, kind of like a 311 setup. And we'll have hopefully some computer comfortable seniors helping people register. It's like I say, it's a very simple format, but I understand there are people out there that won't have access to a computer. So you'll call in, we'll ask you a few questions, we'll fill out the form for you and submit it on your behalf. You'll still be able to pick your time and schedule from what's available. And it should be seamless, hopefully. We'll have a phone number you can call about 12 to 14 hours a day.
Yeah. Okay. And then over to you, Paul. I'm assuming you're going to help organize people in recovery. I saw you volunteering Monday night to drive people to the warming center. So is that something you're planning on doing?
100%. I will be. I'll be helping on all fronts, and especially with Chris out of the health department. Whatever he needs, it's all hands on deck. But we'll be getting everyone the information they need, how to get there. We'll be giving rides if we have to, whatever it takes.
Okay. Very good. Let me see. Well, before we go back to Ron, I just remembered I wanted to ask you, and I know the community has been asking as well about the variant of COVID-19. Chris, what do you know? What's the latest on that? And we'll go over to Dr. Nickerson afterward.
There's not much I do know except what's been reported, and that is that it is here. And with the strength that it has, it's going to move very quickly. And it will change. If people keep gathering, it will change the dynamic of who gets sick and how sick they do get. So if it's easier to transfer to somebody else, it's likely going to get you just a little bit sicker because it's that much more virulent. I'll let the doctor explain it in doctor terms, though.
All right, Dr. Nickerson.
From what I understand is that, yes, it's here. I don't want people to panic too much because we haven't been doing as much monitoring of what strains are circulating in the U.S. and now we're starting to pick up that monitoring. So it may have been here for a little while. Viruses will adapt to challenges put on them. So if we are shutting down social gatherings and stuff, then the ones that are more infectious and easily transmittable will prevail. So that's kind of what you're seeing here, is something that's a little more contagious, a little more easily transmitted, and that's what's circulating. So we have the same tools now that we did at the beginning of the pandemic. Wear your mask, wash your hands, and you wear your mask because it cuts down on anything that you might be expelling into the environment. It also cuts down on what you're breathing in. And if you can reduce that viral load that you might be exposed to, then we know that the viral load is correlated to severity of disease. So your chance of getting much sicker is reduced. So that's important to keep in mind too.
Doctor, is it known whether it's not fatal though, right? It's not more fatal, this new variant, or do they not know?
I don't know off the top of my head. I haven't heard as much about severity of disease associated with it, just that it might be more transmissible.
Okay.
And from what I also understand is that the new strain doesn't change diagnostics, and it's not thought to be, the vaccines are still thought to be effective against it. So that's important too.
Right, good point. Okay. All right, Ron?
Okay, yeah, we're going to keep on this path here. So the next question is in regards to distribution in Malden. Now, Chris, you touched on it a bit. One question was about phase 2. I know you had mentioned Salemwood School. Another question was about teachers, where they would be vaccinated, and then where the first responders would be vaccinated. Is that something that's of public knowledge, or is that, how does that work when you're talking about all the different phases?
Well, it's out there. So I'll say that we're doing the public safety one in Malden at the police station. And it's a closed clinic, what we call a private clinic, for just public safety personnel. The teachers and other staff, people, any person in phase 2 could be vaccinated by the local health department, the local hospital, a vendor, pharmacies, any number of things. When they're ready to distribute the vaccine for phase 2, they will notify those disciplines which population they're going to do. Now, I fully expect that we will have school teachers. And if we do, we'll set up a clinic at the Salemwood School to meet all of the various hours they have. I did get an email today from a teacher thinking it would be February 1st. And I had to break the news that while it says February, it does say February to April. So my best guess would be not February 1st for the phase 2, but probably within that first week, we'll know what our vaccine allotment's going to be and whom we're going to be giving it to. So the state is holding this information close to the chest so that people don't show up where they don't need to be and waste their own time as well as the site management time. So it's important that when phase 2 app does come up, that there's good communication going out as to who is responsible for what. The vaccine is flowing. It's right now, they're just, the only issue I know of is that they are very cautious about giving out more doses than you can actually get through.
Yeah.
And still,
Chris,
be fair.
will this be a statewide effort, or are they going to leave it to cities and towns to decide what order of people are vaccinated? I presume this will be a statewide, or no?
I think it will be statewide. I don't think they haven't given us any leeway to this point. They're just, the issue is they have not assigned a population to local boards of health for phase 2 yet.
Okay, now you mentioned 2 phases. Yeah, you mentioned 2 phases. There could be 3 phases, 4 phases, 5 phases, right?
Well, in reality, there's going to be so many phases. It's because we're going to be doing that second dose, and while we're still doing the first dosing, so it's going to be as confusing as it might be right now for folks at home. It's going to get very much simplified with the software, no doubt about it. Get good information in there. It notifies you of your appointment, all that good stuff.
But do you see on the first shot, Chris, that phase 1 first responders, and then do you think phase 2 will be everybody else, or will there be teachers phase 2 and then general population phase 3, or how do you see that going?
Teachers next, I think, will be the next phase. 65 and over with 2 comorbidities, 75 and older, no matter what, and 75 and older with one comorbidity. So they'll get a little bit ahead in, not necessarily in line, because there is no line. It's that the beauty of the system that they've come up with is you get to choose what works for you.
Okay. All right, Ron?
I can actually assist in that. I just, as you guys were doing that, I was looking at the state's layout, and presumably, Chris, if we're going by the letter to what the state's laid out, it does say that in phase 1, it would be clinical and non-clinical healthcare workers, long-term care facilities, rest homes, emergency medical services, which we just talked about, congregate care settings, so that's shelters and corrections. Now, actually, just if we can cut off to the side, is that maybe back to Paul on that one, but would that include the Malden Warming Center? Does that qualify as that?
That's a great question. I'd have to kick that to Chris. He'd know that answer.
Yep. And Chris and I have talked about it. So, Chris, what's the latest?
We're going to put the warming center in congregate care. The population there is not so large that it's going to hamper anybody else getting vaccine. So it's a good use for phase 2.
Okay.
Just going a little further, home-based healthcare workers doing non-COVID facing care, and individuals who do not come in contact with patients. So people like back office, remote work, administrative staff, if they fall into that category of medical. And then down to phase 2, as Chris points out, individuals with 2+ comorbidities, 75 or older, and high risk for COVID-19 complications. And then this sort of broad other workers category, which is your teachers, grocery, utility, food and agriculture, restaurant workers, employees across food, beverage. So it's this swath of what they call other workers. And then I think a real confusing one for me was a bullet item that just says adult 65+, which I thought was counter to the 75+ comorbidity. So maybe you could elaborate on that.
65 is just the bottom threshold age for phase 2. So 65 and older, generally speaking, and those specific sectors of worker. That's what we'll see. That will be a not a huge population for us, but a good sized one. Obviously we want the 29s through 54s. That's who we want.
And Chris, you haven't heard anything as of yet about it being mandatory?
No,
okay.
It will not be made mandatory. There's been a lot of discussion and study. Basically comes down to constitutionality.
Got it. Okay. Speaking of mandatory, I mean, I guess if that were the case, the flu shot would be mandatory, but you and I were talking again this morning at our meeting. We haven't heard much about the flu.
No, it's been very quiet on the flu front. We had we had vaccination clinics. They were lightly attended. It was surprising to us. We were prepared for a lot more. And we can still help some people if they want to get it. They can just contact the office and we'll try and service them as best we can. Okay.
Dr. Nickerson, you surprised? Because I thought the anticipation back in the summer was this was going to be a horrific flu season.
No, not surprised, because we're wearing masks, right? So we're cutting down the spread of everything, and we're staying isolated. We're doing what we can. And if COVID's not spreading, the flu's not spreading either. So sort of similar thoughts, and it's keeping everybody healthier. And I want to be encouraged too that, we came out last summer and said, please go get your flu shot. And I think people did. I'm really proud of the public, because that's one way that they can take control of their health. And it's not too late. So if you do want a flu shot, absolutely go get it.
Doctor, do you know, was this one of the best years in terms of people getting the flu shot? Were there more than in years past?
You know what? I haven't seen any numbers, so I can't comment on it. But given that there are less cases around, I think that's probably a combination of people taking vaccination seriously, and then, the protective measures that we have in place against COVID.
Okay. Let me stay with you, Doctor, real quick. So we talked about, you could see people wearing masks months, years from now?
Well, let's just talk through the end of 2021, probably through the end of 2021, because it's going to take some time to get vaccines rolled out and to get people protected. So let's just anticipate that, through the fall, we'll probably be wearing masks most of the time. And we're not just going to wake up one morning and COVID's going to be gone. It's going to take some time to sort of recover and find our new normal.
So based on that, Doctor, and I'll go to Chris after and then maybe over to Paul, because Paul does a lot of events for the community. Do you see events being postponed or canceled through the summer?
I think it's probably too early to tell. I think we need to wait and see we'll start to get data on how vaccinating the first responders has changed sort of the viral transmission dynamics. And we're also at a really rough time because we're starting to see the cases ramp up from the holidays and people's travel. So,
okay.
We're going to get more information over the next few months. We can remain optimistic that by the end of the year, things might be starting to get to a more normal state, but I don't want to write it off either because things might surprise us. So we can stay hopeful and optimistic.
Okay. And Chris, a community north of us canceled July 4th events this week. Too premature, or?
I think it's a little premature. It's not something I would be focused on right now. But I think, like the doctor said, we're going to be looking what will drive the decision making on those kinds of events will be how much of the population is vaccinated, right? First dose, second dose. If it's a strong vaccination rate, our positivity rates are way different than they are now, and I fully expect that. By summer, we should start to see a little bit of that transition in that data. So I'm hopeful that we could get maybe some socially distant events in with more people than we've seen this year. I'm hopeful of that.
Okay. And then, Paul, I know this has been real tough on you and your organization. I mean, again, you do a lot of events throughout the year, and one that just passed and for the first time wasn't held due to COVID is your annual celebration of sobriety. What have you been doing to counteract that?
Honestly, we're not doing much. I mean, it's just like everything else. We're online, we're taking phone support, we're available 24/7, but it's been really tough. And back to what Dr. Nickerson said, I'm holding on to hope. So we've missed 7 events so far, and we've met as a board, and we've been discussing looking as far as August. So we know our next 3 events are not happening, and we're going to stay hopeful for our outdoor event come this August. Again, I'm just staying hopeful. I'm not saying we're having it, but that's what we've got. We've got a goal that we're really hoping and praying that this August we can start our events again, and that would be in Lincoln Commons, Malden Overcomes Day. But again, it's just being hopeful. I'm not saying we're doing it, but if all goes well, and it's an outdoor event, wearing masks, maybe that could be possible out in the park.
Okay. All right, Ron.
Okay, we're actually going to back up. I'm not sure that we covered the numbers that was asked. What is the current data for Malden?
Right. Yeah, we should have done that at the outset.
All right, today's numbers are, we have a total of 4,748 cases with 101 deaths. The positivity rate right now is 8.39. That will be updated on the 12th. And we had, I should point out too, that 8.3 now is actually lower than the previous 2 weeks. Our percentage per 100,000 is 65.1, which is also lower. But I think our losses in this segment, for this 2 week segment, will be gains in the next 2 week segment. So I'm not confident that the 8.39 will be lower. I think it will be a little higher, probably 9.25, somewhere around there. But I'm constantly and pleasantly surprised when I think of these numbers. I'm generally a little closer, pretty close, but I'm always giving the people Malden the benefit of the doubt, and they haven't let me down yet. So I just can't say enough about how the community's reacted.
Dr. Nickerson, those numbers, do you believe they are a result of family gatherings? Or do you think it's something else that's driving them?
I think that's probably the most likely factor. I mean, we came off of Thanksgiving, which is a big family holiday, and Christmas, which are both big family holidays. So you have a lot. I mean, I know a lot of people did the hard thing, stayed home, had Christmas over Zoom. And thank you for doing that. But a lot of people also did travel. And even when we say we're just going to extend our bubble a little bit, it can have pretty dire consequences. So we don't think about it. And I think there's another number Chris should mention, and this is a little bit of a scarier number, but it's out of Boston. And that was, I think this was yesterday, they were reporting that their adult ICU bed occupancy is at 93%. So stay home, please stay home, wear your mask, wash your hands, and keep everybody safe.
Are you surprised, based on what's been going on, that the federal government didn't shut down travel?
Oh, I'm not surprised, because we have not had very strong leadership throughout the pandemic. And we know that prevention is better than reaction. And right now we're being forced into more reaction. So people, the best course right now is to not get sick. So please wear your masks and continue to try to stay safe. That's going to keep people out of the hospital, because remember, once the hospitals start to get full, broken bones and car accidents, those are still going to happen. And those people need care too. And we're going to see ourselves in a really dire situation where we're just not going to have the resources to take care of everybody. Sorry, finish my thought.
All right, thank you. Chris, do you want to add anything to that?
No, I'm just looking at the hospital stats to the side here, and the doctor nailed them. So yeah, she's right on the money.
Okay, and Chris, you do think it's family gatherings, you're not thinking it's as much restaurants. You haven't had any violations, have you, recently?
We had some educational violations, I would say, in the early days. People were making mistakes, reading too much into the guidance, but nothing egregious. And they've been great ever since. I have to say that too. The only thing that I would say is we have been very cognizant of checking on our clusters, and we've had very, very few. And the ones we've had are, 2 people. I think the largest we had was 6, and that was one family. So we don't really count that as a cluster, because you kind of expect that a family of 6 is going to run out of space. So that's an unfortunate thing for them, but that's where we're at. Our clusters are generally generated by gatherings. They have not been coworker to coworker or home workspace to workspace. So it's been basically family gatherings. Every one we've had since Thanksgiving.
Okay, Ron, back to the studio.
Yeah, so we have a question coming in off of our YouTube live feed, and one person over there asked about whether or not there are tests available for college students that need them to go back to college. And I'll bundle that with a question of my own, which is college students returning back to school. Does that change the dynamic? Does that lower things because it sort of spreads out and there's less family gatherings?
Okay, Chris?
Yeah, I mean, the kids coming home from school, generally, if they're really good at home and then they go back to school, that jurisdiction where the kids reform has an uptick. So it just moves the problem to the college town in question, really. So it doesn't have a remarkable difference as far as we can tell.
And the testing, schools themselves, do they have their own testing, or, can they expect to get testing from the local health agencies, or it really depends on the school?
It's the school will usually do you upon return if you don't have a test location. I know UMass does you when you leave and when you go back. So that I'm familiar with that. That's how most of the schools are doing it. You're checking in with them because they're controlling that population.
Okay, anybody else want to add to that? Okay, Ron?
Okay, going in right now. We might have cleared our docket here of our questions. We don't have any. We're still waiting for if any folks want to call in. We still can always take sort of the old school way of taking these questions, and that's by calling live into the studio. And you can reach the studio at 781-388-9394. You can certainly ask us questions by jumping on Facebook and then asking right in the comment thread, or you can send us an inbox message, and we'll be happy to try to respond to those. We're available hunting around Twitter, and of course on the YouTube live feed itself. And right now, I actually think that we've completed all our questions that are on there. I'm going to keep digging, so maybe if we can sort of go back to the panel. I don't know, Mayor, if you had additional questions that you want to run by, and I'll take a look here at what's floating out there.
No, we can go back to the panelists. Is there anything we've missed so far, or anything you want to add at this point, Chris?
No, maybe we could talk about Paul's task force that you were so kind to give us an audience on the other day. That might be helpful.
Paul?
Yeah, we're looking to put together an opioid task force, which will consist of police, fire, the school department, myself, maybe someone from the mayor's office, the Board of Health. And we're going to be looking at almost areas, you could call it a problem property, but we do have problem properties in the city. But it's going to be areas, and we're going to focus on where there may be stronger areas in the city where there could potentially be some drug activity, and how we could best, help take a look at that and try to bring that down and lower those numbers. So we're really looking forward to diving in. I've got a bunch of information. We haven't met yet as a group. We met once, but we haven't had our first meeting, and we're looking to do that on a monthly basis. And we're really excited to get this work off the ground, just so we can get the residents the resources that they deserve.
Okay. Dr. Nickerson, anything we've missed so far?
Well, I think there's a lot to cover. I mean, it's hard because, our tools haven't changed since the beginning of the pandemic. Our understanding hasn't really changed. It's, we're coming up on a year, I think. We're a couple months shy of a year. That's a long time to be in isolation or to have your life completely abruptly changed. So, if it's hard, reach out, please. We're all in this together. We're a community. I think that's probably a big message that we miss, and to treat each other with kindness. Again.
All right, very good. Chris, I know a question that we get often. Why don't we have our own testing site? And we've called. We've called.
It's a valid question.
Yeah.
Yeah.
So what's your understanding there?
Well, we've looked at it 100 ways from Sunday, and what people want is a convenient testing site, right? We would like that. You and I have talked about it. We would love a convenient testing site, but we can't convince the state to transfer any of the spread of the stop the spread sites to us, because our border cities are using those resources. So we would end up having to pay for it. And that's not a crime, but it is very, very expensive. And we've got enough, I think, testing in place if people aren't running out to get their Christmas ticket or their Thanksgiving ticket or New Year's Eve ticket. So the sites have mellowed out. I've heard good things about the site at Suffolk Downs. They have a very good put through over there, a very high rate. That's very well accepted. I heard that Square One Mall has gotten better, so their put through rate is getting much better. The lines are much shorter already, which is what we expected to see. So keep checking your sites. Some of them are using this new software, so you can schedule. But I wish it were more convenient. It's just not as simple. The reagents are also still a problem. There are so many sites using so much material that they can't get the reagents to actually complete the test. Cambridge Healthcare has had that problem just recently. So did Leahy, actually. So, yeah. It's the same obstacles, and those that the ability to supply those tests has not gotten better. I mean, they're pushing out millions and tens of millions a week. They just can't do it faster than they are. It's with science now.
Dr. Nickerson, someone gets COVID, can they get it again?
So it doesn't look like people get sick or severely sick a second time if they get it. There have been a few cases that have been reported where people do get severe illness after getting a second infection with COVID, but they're few and far between. I think what's important to remember is it's a lot like the flu or strep throat or any of those other common illnesses that you get routinely, where you can get it and then you can get it again, and it might not be as severe the second time, but we still encourage people to wear masks and use wash their hands and social distance, because if you get it a second time, there is a small window of time where your body has to respond to the virus, and that could mean that your body could produce some and you could be infectious, but it needs a chance to respond and cut that virus back down. So when in that window, you could be a vector that could pass it to others. So that's why you still see encouragement of people to wear masks, even though they may have already had it or they have their vaccine. And it's just to sort of make sure that we're doing our best to keep everybody safe.
Okay, Paul, what are the signs people should be looking for, especially, based on what we've been going through, that someone may be becoming addicted?
It could be everything from loss of sleep, mood change, someone's being agitated, a family friend or loved one is just not acting as they normally act. Eyes could be droopy, but basically it's irritability. It is lack of sleep, or, sleeping too long in the morning, staying out late, missing work, not going to school, not keeping up with their regular routine or chores around the house, whatever that looks like. But if there's a change in behavior, I take calls every day from family members and parents, and we discuss these things. And if you can reach out in a timely manner, it's something we could try to get a hold on before the problem, may get more severe.
Okay.
I had a question for Chris and Dr. Nickerson. I've been taking a couple of questions today, COVID related, and if I could ask it, that would be great.
Please.
And the question is, December 26th, they put into place the 10-person indoor limit and it was supposed to go from December 26th to January 10th, that indoor gatherings could be 10 people. So I had some people call me today from a couple of places in the city asking, on January 10th, can they go back to the 25 people? And I didn't have an answer for that. So I want to ask the professionals, is January 10th still the day, or will that get extended for the 10-day indoor gathering?
Chris?
My read of the current statistics would say that the governor will extend it.
Okay.
It should have been done already. It hasn't, but I fully expect it will be probably, today is Wednesday?
So basically
tomorrow. So yeah, I would expect tomorrow.
Okay. Thank you so much.
Yep.
All right, Doctor?
You've hit on an important point there too, which is that a lot of the regulations that we're enforcing or we're following are set by the governor. So we, as the Board of Health in the city of Malden, can enact stricter regulations depending on what we think is going to be best for the people. But most of them, we're going straight by the state guidance and sort of following their guidelines into what we should do to keep the city safe. So just to reassure everybody that you can find all of the information about the current regulations on the mass.gov website. They have a really nice COVID-19 overview, and know that we take our information from them, but then we also pay attention to what's going on in the surrounding communities. I think you've heard a lot of buzz. I think Boston just made much tighter regulations for the next couple of weeks to really cut down on spread. So, we have a board meeting, I think, next week. So all of that information will be discussed and the numbers will be looked at again to see if we're doing the right things for the people of Malden.
That's why I asked the question. Marty Walsh's guidelines came out today, and he extended the 10-day indoor in Boston until the 27th, which is another 3 weeks. So my phone started ringing from some people in Malden asking me if we are on the same guidelines as Boston. I don't believe we are, but I left it as I will get back to them.
Yeah, we are not under those guidelines as of now. Ron, you said you had some more questions?
Yeah, so nothing like saying you don't have any questions to drum up some questions from the community. So as soon as I said that, of course, it sparked more. So we got some really good ones come in. First question is in regards to the schools. There's a couple of them, actually. Eden Gerhard Smith asked a question online. Frecker asked online as well. and I'll kind of summarize, but basically they're asking, what does the current state of affairs look like for the return to school? And actually Eden goes as far as asking about the fall. But I think Mr. Frecker was asking about the plan that the school committee recently approved with the teachers, and the superintendent announced that there was going to be a phase back in approach for the return to school. And do the current numbers, or are we still there? Are we still on that same track?
Yes, we are. And do you want to go first, Mr. Webb, and then I can add?
No, you go ahead, sir. Go ahead, sir.
Yeah, I think we're confident that we're going to be able to make this work. And the reason being is we now have had roughly 200 students in school for the past 3 months. And so working with the teachers, we think we're ready now to take the next step with having pre-K to 2 back in. Of course, that's with Mr. Webb's consultation and input. And, we think we're ready to move forward. Now, of course, it could change, but based on what we know today, right, Chris, we're willing to give this a chance and see if we can make it work.
Yes, ultimately it comes down to the age groups we're talking about have not been identified as spreaders, which is important. We have been very, I think, cautious with our phased approach, and it's been a great experience working with the school, the teachers. We have great conversations. We have another meeting tomorrow afternoon. And I had a quick conversation with the superintendent. He asked me yesterday, if I thought we needed to change anything, and I said no, mainly because the age group we're talking about, the teachers have been trained and retrained, so that's good. And again, it's a small population. The school can handle thousands of kids. We will probably break 500 or 600 total in all of our buildings at that point. And we have the capacity for a lot more, and our air handling systems are top rate. Again, everybody's trained and ready to understand what they're doing, and we have by-next testing as well, so that if someone is symptomatic at school, we can do a quick 15-minute test and determine whether they need additional testing and should be quarantined, or if they're not sick at all. We can make certain determinations based on that test.
Yeah, and I think, Chris, too, having the students in for the past 3 months, that population has helped us, work out any kinks that there might be with bringing the next segment back. So I could tell right now the communication protocols are pretty down pat on if someone isn't feeling well, what to do, who to call, when to call. So I think those couple of months that we've had together will help us moving forward.
I agree. We can, it's one of those things. I've done it before. We just have to, crawl, walk, run. That's kind of the approach we're taking.
Yep. Okay,
I can attest, as a parent of a Forestdale 7th grader, when I told him about the phased approach, I don't think I've ever seen eyes light up in joy at the possibility of seeing another human, because this poor guy has really suffered, as Dr. Nickerson pointed out earlier, with just the tremendous amount, of stress that it takes just to have, just to do something in a different way like that, to keep them active and whatnot. So that covers the school-related questions. There's another question actually for Mr. Hammersley. So you mentioned early on that the community that you're speaking to prefers that in-person, meeting or care or group work over electronic.
Right.
But can you maybe just elaborate on what sort of options are available to people electronically, whether it be Zoom? How do they get in contact? How do they do this? Any port in a storm, right? If you need to get on and get to a meeting, right?
Absolutely. So MaldenOvercomingAddiction.com. Go to that website. Under resources, there's a tab, COVID-19 resources. You click the COVID-19 resources, and there's every meeting possible, that anything that may be ailing you. There's 24-hour Zoom rooms. You can get into a meeting at 24 hours a day, whether it's here, California, Alaska, and there's a variety of topics. So again, MaldenOvercomingAddiction.com, and also you can get on the cityofmalden.org, the substance abuse services recovery coaching. There's all kinds of resources there as well, but I would start with the COVID-19 resources on Malden Overcoming Addiction, and every link imaginable for Zoom is there for you. It's waiting for you, and there's always people in the rooms on the computer.
And we're going to share that right now just to show some folks what that looks like, and you should be seeing that now. So you've got recovery links in there. So that's great. That's excellent. Excellent response to that. So that, again, that's MaldenOvercomingAddiction.com, and then it's COVID-19 resources. And then a follow-up to that is, do you see this as being an option for, for folks when we do come out of the COVID-19 restrictions? Do you see these online meetings existing in some fashion for folks that maybe, can't get out of the house because of a disability or because of how remote they are or something like that? Will this stay? Has this changed the dynamic a bit?
100%. I think it's going to be a good thing just for that fact. So I think COVID has opened the door, not just for addiction and recovery, but for the whole world to meet in a manner where they once couldn't. So I'm literally seeing, there are still very few in-person meetings where there's 10 people or less. And on a chair in every room that I go in, there's a computer, and that is online. And there are people zooming in to that meeting. And I see that continuing just for the population that may not be able to get there, that may be handicapped. But I also see that on every other aspect of life in general as we know it. But yeah, it's going to be a great resource.
All right.
Well, thank you. We did have just a couple more questions, and I think we'll wrap up here. We're actually at the 8 o'clock hour now, but we did have a couple of folks. We had some technical difficulties with our phones, and the folks at MATV were good enough to take those questions down and text them to me. So the first one is, Joan asks, are there any symptoms that can prevent someone from being able to receive the vaccine? That's the first question. And then we got one more after that.
Chris?
Yes, if you have a fever, we would recommend that you don't take the vaccine on that day until you can have 2 days in a row with no fever. Other than that, there are no restrictions. There was one where if you had been positive, you couldn't get a vaccination for 90 days. But a colleague told me today that they've lifted that. So it's pretty wide open. There are very few things that would keep you from being vaccinated.
Okay. Doctor, you want to add anything to that?
No, but if you have any concerns, call your physician, your primary care, or speak to your local pharmacist, and they'll give you they likely will have access to those questions that they'll use to screen people before they give them the vaccine as well, which will help inform you.
Okay, and our last question of the night, Mayor Christenson, I think you'll be pleased to hear this name. This is a throwback. Patty. Patty was back to ask her question, and it's a great question. Whether or not the new COVID variant could potentially push the restrictions into 2022.
Okay, Chris, and then Kourtney.
I think potentially, yes. Actuarially speaking, yes, it could. Will it? I'd like to think no, because we have the known interceptors, masks, hand washing, vaccination. So we're at a good point for an outbreak of a more virulent strain, but I think it won't be as noticeable except in the hospitals and in treatment centers with contact traces. I don't think the general public will notice a marked difference.
Okay, Doctor?
As the vaccine rolls out, as we get more and more people protected, I think variations in the strain will be, we'll have to wait and see what the outcomes will be. But as far as it stands right now, we can predict that our vaccines will protect you against the new variant. And so that we shouldn't be too nervous at this time, remain hopeful that the tools that we have will be successful. And then think long-term, we still don't know how long protection is going to last. The data is starting to come out. It's starting to look good, but it's going to take time to get that information. And then, how like the flu changes every year. Our vaccines are adjusted slightly so that way we're protected. Some years we get a really good flu vaccine. Other years they're not so good, but it always gives you some level of protection, and it always cuts down how long you're sick for or how bad or severity of disease. So that's really important to keep in mind, so that, we're just starting to build our body of knowledge, and we do have a light at the end of the tunnel. So we might not quite know what the future holds, but for now we should remain hopeful and optimistic.
Okay, and on that note, we're going to wrap up tonight's show by giving our panelists one more opportunity just to provide the city with the contact information in case they have any questions that weren't asked tonight. Let's start with Paul.
My name's Paul Hammersley, and my phone number is 781-838-2203. And my email is phammersley, HAMMERSLEY, @cityofmalden.org.
Okay, Chris.
Good night, everybody. My name is Chris Webb. I can be reached at by email at cwebb, WEBB, @cityofmalden.org. And you can reach me by phone at 781-397-7049.
Okay, and finally, Dr. Nickerson.
Okay, thanks everybody. Have a good night. I'm Kourtney. Please send your questions to Chris. He will send them off over to me, and I'm happy to answer them or help you find the resources that you need to answer your questions.
Okay. Once again, thank you to our panelists. Thank you to Ron Cochran for organizing tonight's show along with Malden Access Television. We are going to make it. Hang in there, everybody, and just keep doing your part. We'll see you again soon.
Thanks, everyone.
Be safe.